Okay, so the first thing to assess that we've got in our list, number one, is the diaphragm palpations we talked about. We want to try and avoid focusing on oxygen and sucking in air and all this jazz, because we can do it with so many different places that aren't good for us, certainly if we don't have that greater connection. So the palpation is all about getting you there. So what we're going to do is, effectively, we're finding the border of our ribs. So you're just tracing around, find your rib cage and work your fingers around and underneath. Now, to create more space, we then do a slump. So I'll go side on, and you can see I'm bringing my elbows forward, just resting on the back of my hands, and then just putting a little bit of pressure into my ribs like that. And the goal here is then just to breathe in and feel it move. So as I inhale, my fingers will kind of get pushed out, and as I exhale, they'll go back in again. Now, for most of you, you'll find that almost impossible to do. You'll breathe in like this, and nothing will happen, even if you breathe in quite deeply. And the reason for that is because, as I said, we're breathing around the diaphragm, not breathing into it. So that palpation is there. Remember, just so we're clear, as disclaimer, you're not technically touching your diaphragm. Your liver's going to be in the way. So don't push too hard. You're not trying to dig into the body. You're just trying to create a kinesthetic connection with your fingers as to the one-to-one correlate. You breathe in, the fingers start to move, or the pressure increases. You exhale, it comes off again. And it's as simple as that. And just build it up. So I use this with my clients all the time, certainly the stressed office warriors, and it changes like very, very quickly. They get a really big parasympathetic response and be like, oh, I feel much better now, I'm more chilled out. And more importantly, as we said before with breathing, it's not about that immediate effect. We're trying to build strength and awareness in that area because it's a muscle. So fingers in, 5 breaths I'd recommend, and do it throughout the day until you can aim to try and do it without your fingers, so you still feel like you're breathing downstairs, without any problems. You'll start to notice a difference, I said, quite quickly. See how you get on, but it's fingers in. Okay, so number 2 is the seated side opener. So we're supported by the chair. So I'm going to just spin this around. So the goal here is simply to reach up and to lean slightly over. Now, because it's a breathing focus, you're still thinking about your spare hand is going here, and you should be able to now breathe in into this space. Now, for some of you, this will happen. You'll go straight upstairs. So you'll go, and it'll just be all up here, which is not good. So I tend to say for beginners, pop your arm down and just drop that shoulder, and just see if you can create some shortening, some lengthening, and then hand on your leg and just try and breathe in. And if that goes loads better, you're like, okay, I've got some neck stuff going on, so I don't want to drive the arm too soon. You could put the arm, back of your head, back of your neck. Another common thing you see when people try and do this drill is they will perpetually lean forwards, so they'll just sort of get shot forwards, or they'll do something weird with their neck. It's very important you're upright, not forced per se, don't give it the old shoulders back jobby, just sit up straight and just try and do a perfect side lean. The range of motion is completely unimportant, it's just to see where you're at. You might just go, ooh, crikey, that's impossible to do, I can't do that. In which case, just work on a little bit of shoulder motion, and again, just breathe. And just 3 or 4 breaths in that position. Same on the other side. See where you're at. Okay, for example, I breathe way worse into this side than this side when it's lengthened. All right, and I can work on that in my own time. Okay, so last one is rotation. So again, we use the chair, we can sit. I think a lot of people would do this kind of as a stretch anyway. This is lighter, as I said, it's breathing focused. You're just having a bit of an assessment of where you're at with it. And what I tend to do is I put my same side hand I'm turning to on the side, and then I just lightly place the other one on my leg. That might be too much for some of you, in which case just use this leg and just encourage, don't push, just guide it the rotation. It's what the reason for the arms is, it just stops us trying to go into a flare or extension, i.e. trying to grab at the back. So you're just lightly turning, no cramping. If you get any sort of reaction to it, you've gone way too far, or it might be something that's very unknown to your body. So you just maybe do a tiny turn. Make sure you don't drive it with your head. You're not trying to do a competition where you turn as far around as you can. You're turning from here, okay, not your head. So we're here, same thing, we breathe in. Good coach on this is make sure you sit on both bum cheeks. Again, some people like to sort of do this sort of stuff, okay? And then same thing, do 5 breaths, turn, and do another 5. And your job is just to note down which side breathes better. Whenever you do this, the side lean or the rotation, and the same goes for the diaphragm press. And that's your assessment done. Okay, so this is where we pretty much take some of the exercises we've done on the floor and we start putting them into here, and they're very similar looking to when we did just the general releases sitting down originally. This one, we're actually purposefully slumping. Now to slump effectively, it's not about trying to force a stretch. What you're learning to do is try and be aware of your middle. So to slump, the first one I think we all know pretty well, which is thoracic slumping. To drop the head, we slump like this. And to try and slump your lower back, you really have to almost maybe actually coach it to do it. And then you're just looking to drop slightly, and don't go too far. If you feel a nervous sensation through your spine, be nice. It's not bad, it's just actually flossing the nerves, which is good for them, but you know, be nice. You want about 3 out of 10 basically on intensity. So if you just do this and you're like, whoa, God, I really feel that, then you probably don't need too much slumping at your head. Maybe you just want to slump the lumbar spine a bit more and go, oh yeah, that's actually what I can do, and then coach you with the head. Okay, so from there, we then going to go into extension. To grow, we pick the whole lot up and on purpose. Remember, I'm going up, I'm not going out. So I'm not trying to jam my vertebrae, I'm trying to lift away from my legs. I then lift my chest and I then lift my head. Notice how I haven't glided my head, I'm lifting my head. And you can see how much taller I've got. I really am trying to pick myself out of the seat. Again, I'm trying to do it evenly on both sides. You might find one side does it better than the other, in which case, coach the side that doesn't do it as well. And then from there, I go back to my slump. I don't lean forwards, I drop and slump back down. Okay? All right, let's spin this round. Next one is gentle rotation. For gentle rotation, it can be extremely like what you did for the breathing if you want it to be. It can just be a nice easy turn, hold, and then turn back. For this, when we do the movements like this, there is no holding of breath. If you hold your breath, you've gone too far or you're slightly misunderstanding what we're doing. So again, same goes really, to be honest, if you're having to breathe to do it, that's okay, but ideally you should just be able to do the movement. As you get more advanced, take the arms away and just try to turn without them and turn. All right, and the next level is bringing the arms up and starting to have them as a distraction. Most of you, some of you will want to now start pushing and pulling with the arms. It's central awareness. So if this feels totally different, and you can see the difference from me, how much easier I can turn like this, and then I put my arms up, and how much more restricted this is, you can start to understand. If an amazing dude like me finds it hard, maybe you do too. So be nice, pick a level that works for you. You can challenge yourself, but you're trying to build association with your obliques and your abs. Again, watch out for pitching over or side leaning as you do it. So, for seated side bending, this is where we take it up a notch. So now we're putting a hand off to the side of the chair and we're on purpose going over there. We're creating a little bit of load here. Again, no breath holding, and then we pull ourselves back. And you can keep doing the same side if that helps you with your organizational skills. But if you want, you can go opposing. Just make sure it's about this fast. We just go over, we hold, feel the load, and then come back. Big thing with the head has to come with you it shouldn't, it shouldn't try to resist the movement. So we go over with the head, but we're loading here. I'm not trying to stretch my neck. Don't be like hanging down with the head. I'm just creating load for the side and come back up. Okay, so for crocodile breathing, I could have just sent you a photo, but I thought a video would help, just talking you through it real quick. It's on our front, prone breathing I call it, or it's called crocodile breathing if you want to have a look. And the point here is, you're learning to relax into your center. So you've got great floor feedback. So you have to start here. This is level 1 of breathing practice. We place one hand on top of the other. We place our forehead on there so we've got room for our nose. And some of you might be very congested in the armpit. You're looking to try to relax that open and rest your head. The head's supposed to be in neutral, i.e. slightly lengthened, okay? So from there, we're here, relax the chest. The feet and the legs are slightly turned out, so I'm on the inside of my knees. For some of you who will naturally point your feet together, that's also a bit of a thing. So you're actually going to force your legs slightly onto the inside of your legs, i.e. you're slightly turned out. From there, you're looking just to relax and you're breathing neutrally. So we're trying to just inhale and exhale. Again, how deeply you breathe and how you do this, it's up to you. For me, I tend to take quite a few breaths until I've settled and expand. But you're trying to breathe into this, lower rib space and just feel how it waves in and waves out. The best way to breathe is laterally on this exercise. That's out to the sides. Don't focus on trying to push your belly anywhere. It doesn't work like that. Focus on your diaphragm and try to let go of any tension areas across the whole back of the body. Okay, so the next one to look at is what we call supine 90-90. And what I'm going to do is I'm going to make sure I've got 90 degrees at my knees and my hips. You might have seen this before. And then we're lying down. We're making sure the neck's long, the chest is relaxed, the ribs are slightly drawn down, and you're just gauging where you are on the floor between, left to right on the body. So you might find you're gripping on one side of your body. Just try and let that go and even up the weight distribution across what you can feel on the floor. The shoulders are open and relaxed, and I'm just going to practice breathing in this position. Okay? For some of you, as I said, it looks easy, but you'd be surprised how much that will restrict your breath. So take your time with it, respect the exercise. You're looking to spend 3 to 5 minutes there just hanging out. For some of you who have got real bad, ability to hold your head in the right position on the floor, it's a bit too straight for you, just grab a small cushion and put your head on it. It's absolutely fine. All right, so prone hold loading is where we take crocodile breathing or prone breathing just into an active level, and there's a few of them. Don't worry about my lower body if you can't see it. It's not too important on this exercise. Same leg position as crocodile breathing. So we're going basically from here, and what we're asking our body to do now is to actually hold itself in the right position without gripping and bracing. So people tend to mistake lifting your head with turning on your whole body. It's not. It's a top-down driven exercise in this case. So we should be able to lift our head without gripping our glutes and squeezing this and grabbing at that. So make sure when you're here, you're just practicing lifting the head, maybe do a couple of breaths there, and then come back down for a little rest for a second if that's quite hard work. No problem at all. Level number 2 is obviously to try and maintain it for longer, but then we start to adjust the body position. We'll bring the arms away completely, and we'll be slightly almost pulling myself up the floor, very gently. Don't be aggressive because then you might, overdo it. You're just trying to build a good full body connection, good relaxation. Again, holding the head tall and do the breathing. Biggest thing I see go wrong here is this. All right, it looks the same, but now I've completely inhibited my midline. Okay, this neck gliding, learning how to actually lift your head is very, very important, and it's the key to thoracic mobility, which everyone seems to want.
All right, we really don't drive it from our chest. See how I've just inhibited everything? I've got to lift. It's this way. My head goes away from my shoulders, not up. All right, so I just pull it. It's like someone's got hold of it and they're, you know, pulling me along the floor that way. That's all I'm looking to do. So that's level number 2. And then level number 3 is where we start to play around with raising a limb or 2 or all 4. I know you can't see my legs very well, but you get the idea. Same principle, not up, but just balanced. I shouldn't be lifting and breaking everything I built beforehand, okay? Time-wise, I probably do, if you're doing the lifting, maybe hold it for just 1 breath and then come back down the exhale. Take a breath rested and then repeat. For the others, just see how you feel. This is all about breathing, remember. Ooh. Okay, so dead bug and its various variations. There's a lot of variations out there. And most of them, for me personally, when we think about breathing first, moving second, they're all very, very advanced. And that's okay, you know, that's maybe where those people are at. But for a beginner like me and maybe like yourselves, we want to just take a little bit more gently and methodically. So we've literally just graduated or practiced a supine 90-90 position. So what you're going to do is you're going to be breathing in, holding, we're going to be raising a leg, raising the other leg, and then putting it down on our exhale. So we're starting to learn a bit of pause breathing and just starting to get a gauge of how our body has to counter-contract leg or limb movement. So we're here, firm, raise, counter-contraction, and back down, okay? So you're really watching for what happens here. So for example, if I just blow out big time and you can see my neck's getting squashed, everything compresses, we're still not quite there yet. So what you can do is you can just raise 1 leg. So you're focusing on your midline, you breathe in, hold, just raise 1, feel the challenge through the whole line of the body, exhale, place it down, okay? And then repeat. Another way to do this is to drive it with the top, giving you a bit of support. So what I do is I push my hands into something, create an extra bit of support for my upper body, and then I can raise my legs and start to work top down again and practice dipping 1 leg down or have legs down, slide a leg away, bring it in, anything you want along that variation. But I wouldn't go unsupported both ends from the word go. I think that's too difficult. And it'll mess with the breathing and cause a lot of compression injuries or compression niggles that people experience all the time. Anyway, you're trying to undo that with this stuff and build your internal strength, which takes a lot of relaxation. I spend a good couple of weeks on those 2 exercises, the prone and this one, getting my clients to actually relax enough so they can feel the depth of what's missing, because it's very easy to use a hip, a neck, a shoulder to compensate. All right, so be super chill and support yourself. So spinal pressing is a little bit of a twist on the supine 90-90. Now we've actually got our legs on the ground. So you pop the feet down, bent legs, and you can progress this. I'll show you in a second. But we're like so, and you've got a towel or some sort of target under here. People with a lot of back pain, this is really cool because not only do you get to touch the area, you start to sensitize it to motion as well. So effectively what we're doing, we've got our towel underneath and we're practicing just squishing the towel. But the big thing here is we're learning to do it with the core, not the hips or the pelvis. It's very, very easy to be coached to squeeze your glutes and tuck your bum under. No, that's not your abs. They're not going to help you out. Your glutes are not going to help you out when you're standing up and just chilling out or wanting to pick up a pen off the floor. This is about spinal ability. So you need to drive it from the rib area. You could coach that. You could coach it from the point of contact. All right, but sensitize yourself, and you're looking to just do that and hold contraction. For some of you, this will be a bit of an eye-opener and incredibly difficult. And you'll be like, oh my goodness. The other one is obviously watching for the neck and watching for wanting to compress the neck. So as we said before, cushion underneath the head just to help those individuals out with that stuff. Okay, to advance it, just spin around. To advance it, you're going to be practicing moving your legs further away from you. So it'll be a simple fact of just slide a leg down and see if you can maintain the same position. Okay, just hold it maybe like 10 seconds, bring it back in, do the other side, see if you can maintain pressure. If you get really good, you can put both legs down, all right, and work on that same spinal connection. I'm not quite there yet, this one's super hard for me to do, but as I said, it shouldn't affect you, it shouldn't be grossly tense. This is about rebalancing the body still, so be nice, get accurate rather than contracted. All right, so the very famous all fours position. I have to spend a lot of time coaching this one. It's very interesting how it's taught. As I said, the way it's been taught affects how the clients perform it quite considerably. So if you build on everything we've said so far and all the other moves, you can start to understand that we're not trying to drop our belly to the floor and, you know, lift our head like this with no other activity. You know, we're not just doing it from this point and this point. We're actually doing it with the whole spine. So the first thing to learn is, that's why we do the floor work first, is to learn this lifting of the head. And you can see what that does to everything else. So I haven't talked to my shoulders at all, which is also what happens to people. You know, they've got no neck awareness and they're just braced at their arms and they're gripping on for dear life, but this is loose as hell. All right, remember it's midline coaching. So we lift through the head as if I want to come off my hands. I'm trying to pick up from about here in my head. All right, and that's the important part. It's not this. Maybe later on it will be, but first we need to learn how to pick the head up. Technically the back of the head up and that way diagonally. So anyway, that's the hardest bit people get wrong. So we're nice and tall like this. So now everything else is quite free and easy. From there, we then coach the very deep parts of my back, my slightly tucking my pelvis. Maybe for some of you, you won't need to do that yet. You can just leave it hanging out and just coach the head position, and that'll do enough. Then we go into flexion, and again, flexion's taught in a very interesting way, but when we flex, we're actually trying to contract our stomach. That's what the exercise is all about. It's not how far can I round over my spine, all right? Because as we know, most people have got a perfectly well flexed spine. Now, don't get me wrong, there's nothing wrong with that because maybe we need to mobilize it that way. That's okay. I'm not saying anything's wrong here. I'm just trying to highlight the things that tend to go wrong and people complain to me about when we're doing the exercise. So the major cue here is tension. Build tension here, then you can start to tuck your bum under, no squeezing your glutes, remember it's abs, and you just keep going until you're really happy with your level of contraction. You can pretty much make your abs cramp in this position, it's pretty amazing. And then you release, and then we grow with the head, all right? The arms will naturally do what they do if you get the head right. Okay, so it's flex, extend, it's not dip and squish or whatever it is, okay? Cool. Okay, so tail wagging, I tend to do just to help people out that can't actually axially load. That means sit and side bend. That can be very compressive for some people's spines. So this one's super safe. Your spine's completely free. It's got no pressure on it. It's super nice. All you do is you draw one shoulder down and you're trying to move the same side hip towards it. But a bit like a lizard, I'm not pushing my hips to the side. I'm lifting. So effectively I'm pushing my ribs at the moment to the right as I do the drill. And then the same goes other way, ribs to the left, hike, and this will open and close. So we're learning a little bit of contraction and a little bit of, a little bit of stretching and mobility too. This is super nice for people's backs and also teaches them a good skill of the frontal plane. So be super nice with that. Again, it goes without saying, all the other skills apply of staying tall and open, and watch out for rib flaring. So we're not trying to push our ribs to the floor, we're trying to keep them in neutral. Okay, so standing and stacking. Super cool exercise that you can do during the day if you've been sat a lot, and just to remind you of how to get nice and tall. So, we start with the feet and we work our way up. I tend to anyway. As you get better at this, you'll probably find there's one area or two areas that set you up and get you there quicker, but we'll do the whole thing today. With your feet, the first thing to talk about is 3-point thinking. So we've got the big toe, the little toe, and the heel.
and they should be down evenly together all the time. So when you're standing at least. So once you're on your feet, just have a little feel of maybe you're on the outsides of your feet more, the inside, the back or the front, and just get yourself to kind of play around with your weight distribution. Of course, as long as you're standing on something flat, and just see how you're doing with that. Once you're happy with that, you're moving on up and you're thinking about your knees, and we're softening our knees. Now when I say soften the knees, I don't mean bend your knees, I just mean kind of take them from like this to like this. They don't really change, they're just changing your mind. So when you're doing this, if you can't kind of get your head around that, then just don't worry about it. It'll happen on its own later on. Then we move up to the pelvis, and we're thinking about the back of the pelvis more importantly. We're not trying to turn it, because again, this causes this whole contraction idea and manipulation idea. What we're doing is we're just perceptually, like the knees, letting the back of the pelvis go while letting the front of the pelvis stay tall. So it's almost like the back meets the front doesn't turn to drop the back, yeah? So just relax it. From there, we've got this kind of now, maybe for some of you, this kind of sensation of changing what's going on at the front of our body. It does change quite a lot what happens at the stomach as you get better at it. Don't worry if it hasn't changed yet. And we go from here, we're lifting. Rib cage does the opposite though. It doesn't militarize, it releases and drops. At this stage, some of you might be quite stooped and thinking, oh my God, this is terrible, I've got to change it. Don't, just leave it as it is. Even if the shoulders feel forward, we're not going to be changing the shoulders. You know how I feel about those. If you've got shoulder stuff going on, it's going to be driven by this guy. And so we're going to lift our head. Remember the skills we've learned from lying down and from our box position, and we're going to take them and put them into practice standing. And you can see the huge difference that makes to my shoulder position. But if I'd have said shoulders back now, you can see that leaves my head with nowhere to go but compression. It doesn't really know now. I'm not getting a lot of sensation from it. And because we work centrally out, you know, we're going to have problems. We're going to kind of mix it up around the wrong way. So lift the head, release the chin tension. So watch out for the head lifting up. Just drop the chin, and there we go. And then just scan the whole thing and soften it and adjust it so you're not tense. For some of you might be, that's okay, just adjust it. You'll also find that one thing stacked with all the others kind of blows them all out. That's normal, that's called organizational skill. So that's the cerebellum. So if you're not very skilled at standing in neutral, of course it's going to be challenging. So don't give yourself a hard time about trying to do everything at once and constantly chasing your tail and becoming stressed. The key here is soften it all. Just take a rough outlook on it and just think to yourself, well, instead of standing like this, I'm going to try and just get my feet sorted out and then maybe just move my head a bit. That's a million times better than, you know, this. So that's fine. And just, you know, just use this as a reference to kind of improve. Make sure you don't use a wall for this, because you're going to over restrict yourself, over tighten, and it's all going to go wrong. You should be able to breathe well in this stacked position. Okay, so spine circles, you can break this down however you want, because it's quite a complex exercise. So what we do is we lean to the side, so I'm opening one side, closing down the other, and then I'm going to roll my body round, and then I'm going to restack back up to standing again. All right, and then I reverse it, and I roll round. That's kind of the beginning of it. Now for some of you that'll be like a mind bender, and it'll be really hard not to move your pelvis and your legs and everything else. So what I'd say start with is just practice lifting one shoulder up and relaxing the other one. Let your head go with you, remember. Watch out for this countering of the head. Goes over, raises, and reverses. All right? To add in the roll, all you have to do is effectively like do what you've learned before about slumping, is slump yourself round, watch out for your pelvis joining in, keep that steady, and then work your way round and restack yourself. You can slightly exaggerate the tallness and then remember to slump it back down. Okay? Notice how deliberate I'm being with my speed, so really take your time initially and just work it round nice and gently. So just to give you a last demo on it, just what it looks like in its entirety, roll, and
until, and I keep going that way, maybe 5 times, and then I change the direction back again and go the other way. Okay, so supported bending. For this one, we're starting to add less mobility into the spine and start to add some integrity and stability to the spine from a standing position. So I've got my chair here, and what I'm going to do is I'm going to practice hinging my hips and just having my hands down. Now, it doesn't matter if you can't hinge well. Maybe it's all over the place, you know, one side's over, we're just completely rounded over. That's fine. What you do is once you're on the chair, is you then try and relax and hit a good setup position. I think we can see a similarity to all fours now, yes? Good. So you do exactly the same things with the head, and then what you're going to do is orientate yourself so you feel like you're going to lift off, and you can do it easily without sort of falling onto your toes. No gripping with your toes. That's very, very bad. That tells us we're really not using our spine very well. So avoid that at all costs and just sit back a little bit further. If that's hugely hardcore on your hamstrings, the backs of your legs, and it's pulling and it's burny and horrible, then you've just gone too far. So you want to find something that's a bit more easy for you to do. That's a range of motion change, by the way. That's how we stay effective and progressive. So nice and tall like so, and then all you're going to do, become aware of your whole body, left and right, all the cues with your feet. So 3 points down, lift with your head, so I'm lifting with my head up and really stand. Okay, and I repeat, go down, hands on, feel like I'm in neutral, use a mirror, it's best to as a beginner, just so you can see what you're doing, and then lift and drive yourself tall. Okay, so mobilizing the head and neck, something we didn't really talk about yet, that's quite important. I don't always talk about it, but based on the fact this is an office series and you guys are probably all thinking about your posture, and based on what we said before about, we know it's not really the shoulder blades that are the issue, it's the ability to organize your head. I think it's a good addition. So really when we're holding our head, the first thing to consider, if I go side on, is, as we know, this head migration forwards. But a lot of people, again, as we said, tend to coach it from the thoracic spine instead of just a light orientation. We don't have to force our head backwards because it's not really backwards that we're looking for. What we're looking for is resistance of compression. It's this compression here that causes the shoulders to feel all funny and unfunctional and not very strong and all that other stuff, okay? So your ability to hold your head tall automatically, as we talked about before with standing stacking, tends to encourage that. So when you are sitting, the goal is not to stick your chest out. That will kind of naturally happen. But if you're someone that's prone to really talking to this space all the time, just put your hand on your chest and just try and lengthen your neck, and you'll feel this kind of contraction go all the way down through your center. And that's what we're looking for, just that light lift. And that then sets everything. We're not forcing extension, but we're just encouraging neutral. Now that won't last for very long. You know, certainly if you're someone, you know, that has issues with their vision, you're gonna find, and fatigue, you're gonna find that you start to migrate forwards. That's all right. Just from time to time, remind yourself to restack, soften your pelvis, don't let that start joining in as well, and just set your head in a nice place, okay? And that's the easiest way to coach neutral. As I said, it will fatigue, get up, move around, and everything else, and also do these drills. So drill number 1 is turning. When we turn our head, we want to think about the front and back of our skull. Lots of people like to exaggerate this. Lots of people, when they turn their head, they push their chin out, or they try to overdo it. We just want the back of our head and the front of our head talking to each other. As savage as it sounds, but like you do if you want to break someone's neck, it sounds pretty aggressive, but we are thinking spin here. We're not thinking push or pull, we're thinking spin. Second thing to mention is it shouldn't feel like a stretch. All right, you're not trying to stretch or involve your shoulders. You're just going to your limit and coming back. It doesn't matter if it's not very far. For me, this way is a bit weird. Like, I don't find it as easy as this way. I can turn my head right around this way. This way, it gets a bit stuck and I start trying to grab at different muscles.
don't do that, just stick with the range. They don't have to be the same. What you're doing here is you're creating quality motion. Okay, we're not trying to stretch anything. And you build this up over time. Make sure you're definitely turning top down, not bottom up. Again, trying to fixate the shoulders in some way. Number 2 is down and up. And when we go up, side on again, remember we don't want the glide to occur. We don't want the glide, we want up. Again, if you can't do very far up, it'll just be eyes up and just a little bit of up. And then down. Any dizziness on these, and we know we've got some work to do. So just chin down and up, not slump, just the chin. And we're just doing the neck series right now. Brilliant. And then the last one is lateral tilting. So we just side and side. This one, a lot of people have lost big time. Like they'll just go, that's it. And then they'll start doing some kind of rotation or side leaning or something like that. So this is a real big one. Coaching is quite challenging. Sometimes what I say to do to people is support your head and then just try to side lean it. But it will come back over time. Remember, this is accuracy, not tightness. You've just lost the awareness of how to do this exercise. It will come back with practice. So we're just into the side. Again, watch out for the chin wanting to jut out. Make sure, if anything, you're maybe slightly tucking the chin, if that helps you out as a cue. So those 3, we've got turning, up and down, and tilts. The last thing to consider is how our eyes work with our head. So initially I would say do it without the eyes, and then I'd say do it with the eyes. And what I mean by that is, let's say I'm turning my head to the left, I'll do it slightly off center for you. I will look where I want to go as a good eye exercise. And then same goes this way. I will look with my eyes, and you see I get a lot further. Okay, and then if you do it without the eyes, so if I just look at you and turn my head, you'll see I can't get very far at all, and if I try a bit further, that's about it. So the eyes are very powerful when it comes to how they coordinate with our neck. They are integrated. So you can use them to your advantage, or you can challenge either or. Doing it with your eyes closed is also another option. There's a lot of different variables here you can play with. Main thing is decide what you're doing. You're doing your mobilization of your head, in which case don't worry about your eyes, and then maybe do a few where you really push it with the eyes as well. And that goes with up and down. So up, really look up, and down, really look down. And so when you're doing the tilts, you can imagine we're just trying to keep our eyes fixed straight ahead. The last one to do, having talked about the eyes real quick there, is some kind of shape. I tend to say do a circle, and this is called gaze fixation. Technically this is called VOR, but we will call it gaze fixation for you guys because it's obvious, right? We're looking at a target and I'm orientating my head around it. Any loss of accuracy here shows, like if my eyes start doing this, I don't know if you can see that, if I start just glazing over and looking somewhere else every time I turn my head, that's an issue. We should be able to integrate head motion and eye isolation or eye fixation at the same time. That can cause a lot of headaches, a lot of dizziness, things like this, and general eye weakness, hence why we talk about drive it with the eyes occasionally, like move your eyes to that side or that side and get a gauge of where you're missing it, because that can really be related to your neck discomfort. So a couple of few tips in there, and a little bit of mobilization where you're sitting at the desk. As I said, that doesn't trump getting up and moving around, because we're just encouraging more fixation here. So we do actually need to move around. But it's just a nice thing to bear in mind if you are sitting and you've already done some exercise and things, and you've got, just using that time just to get some in, that's fine. But yeah, cool. See how you go. So shoulder shrugging and moving the shoulders around. So as some of you short and low by now, I'm not a big fan of manipulating the shoulders around. It's not good. It starts messing with the neck. So it's neck, then shoulders, not shoulders, then neck. So for the shoulder shrugs, we are just going to start out by just lifting and lowering. Now, some of you will be tempted to, squeeze them backwards. Don't, just go up and down. And you'll be surprised how hard this is to do for some of you. You'll literally be able to do this, or you'll just feel like you're squishing your neck tall, lift these up and down. This is a very important cranial nerve to stimulate. All right, so being able to do this from the shoulder blade itself. So if you see from the back, I'm lifting up the whole shoulder blade here, rather than just my shoulders and my neck. So they're not migrating forwards, I'm going up and down. That's why I think people think about moving them backwards. It'll happen with better coordination. And we just keep this going. You're looking to do this around 30 seconds to a minute of just this exercise. You'd be surprised, as I said, how hard that gets. So that's just shoulder shrugging. Okay, elbow circles. This one's really, really great at restoring better shoulder stability. You can do, shoulder movements like this as well. There's nothing wrong with a bit of this, just to calibrate that for you guys. Okay, this is one I teach a lot as well. Obviously watching out for brushing your face. Your hands shouldn't touch your face as a general rule, okay? But the elbow circle's a bit more specific. So I'm coming in and I'm starting to rotate. So this starts building up external rotation of the shoulder with the hand and elbow included. And then the other way is internal rotation. So we just start sweeping down. All right, so we're going this way, turning palm down, in, palm up, and then palm down and out, palm up, palm down and out. Okay, and that's the elbow circles. Okay, lastly, we've got arm raises. Now, for a lot of people, I was tempted to kneel down here. I'm gonna kneel down. I'm gonna do it. So, kneeling down. So, for arm raises, range of motion's a big deal. So, lots of people can't lift past here, which means probably don't. Because if you force range of motion, something's gotta give. As your center system, that's why it's constructed all this way for you. The center system controls the tone and abilities of the proximal joints, like your shoulder. So as that gets better, you'll find your range of motion will go through the roof. You don't have to coach it from the shoulder because you're just encouraging it to brace and tighten even further. So please don't force this stuff. So for the arm raise, it is simply just one arm, by the way. You can do it similarly like this. You can sit down and do it. Don't have to be standing. And you're just practicing up. Remember, it's up, up, not down. Again, that's why I don't like all this shoulder focused stuff. Reach. You're just reaching up and then let it come down again. And then you're up, reaching up. Notice how we go up and back down. Now, what can't happen when you do that, if I do it this side, is we can't have this occur. This is where I said the mix has happened. We haven't got stability in the neck followed by mobility at the shoulder. We've got them both fighting each other. So it's neck, then shoulder blade and arm, and then back down, okay? So really make sure that's clear to you and your body. And that's the arm raise. Big thing with leg slides is to make sure we're actually focused on the slide part rather than, the body part rather than the slide part. So again, from their bridge positions and stuff, supine positions from before, ribs down. I tend to use my fingers. I use my middle finger and thumb. Thumbs on my ribs, middle fingers are on my ASIS, or the front of my pelvis, and then I'm going to practice staying tall and uncompressed and slide my leg away and then bring it back in again. Okay, and you can keep going on that same side, and you can start to make it very light on the ground without losing your integrity through your core. Watch out for your shoulders, and then you can play around with the other side. What you're looking for here is forced extension. So we're trying to keep the ribs down while you do it. Perfect. Okay, so for the donkey kick, it's super important that we first of all know how to hold a good box position, i.e. the neutral position, especially with the head. And then what we're going to do is we're going to aim to lift the leg and just raise it up slightly. You can notice how I haven't gone very high, and then I'm going to come back down again. For some of you, that'd be incredibly difficult to do because you'll feel like you're falling to one side. What I do is I just place the leg. I'm not using in between my hands, so it's now centrally in between, and that'll support me much better while I practice my stability.
Okay, and I don't try and bring the other leg back in. I'm focused on my framework now, 1, 2, and 3. Head tall, and just lightly move the leg. You're trying to detach your leg from your middle. You're not trying to join in with everybody. So we're learning just to move the leg. So just so you can see that from the other side, I place this leg into the center, and then up and down. Common things I see is that people either lean back or lean forward to initiate. So make sure you've understood the box position and you're challenging it as opposed to just trying to lift your leg up and down. Cool. Okay, so for leg raises, they're kind of a next level up from the leg slide. So what we're doing now is you're going to have this leg as a support leg, but it's not to push down with. It's going to support you, but it's not there to push you. And the way you'll know that is if you get lighter on the side of the bent leg. So as I lift my right leg up, I'm dropping the left side of my hip into the ground. If you can't lift your leg very high, it really doesn't matter. Just work with the range you can do, but make sure you apply yourself to the speed and relaxation of this exercise. It's a deep core exercise. So just lifting your leg up and down going, oh yeah, look what I can do. That's not the point. We know you can lift your leg up. What we want is we want a slow, deliberate initiation like this, a pause, and a slow deceleration. And aim to do 10 of these. By 10, you should be pretty fatigued. And that's why, because we're moving quite slowly. Once you've done 10 on one side, switch it over and do the same. Okay, the famous shoulder bridge. Oh my goodness. So I will aim to try and keep this as short as I can. Bottom line is, don't try and over squeeze your glutes. That's not the idea of this exercise. The idea here is, one is your inside unit, what we call your deep longitudinal system, and then second is your lateral system, which is your glute and your lat, all right? They're secondary to the deep longitudinal system because of the nature of this position. So pretty please, don't focus on your glutes. It's the surefire way to have, if you like, long-term back problems, in the sense of spending a lot of time standing or moving. You'll be basically unstable. When you're using your glutes, you'll be good, all right? Is there a carryover if you don't do it 100% correctly? Of course there is. I'm just saying this so you're aware of both sides of the coin here. And most people are taught to squeeze their glutes, and it bugs me because they're normally the ones with the back pain. So, rant over. Focus here is hips, or should we say feet, knees and hips are in line in this version right now. From there, you're looking to become more aware of your middle. So basically went from my bum up to my chest, and then I'm gonna focus on levitating my hips up. No squeezing of the glutes, as I said. For some of you, that'll be really tough, and you'll feel like, oh my God, my back. Good, that's the bit that's missing. Remember, you built up to this position already. Now, for some of you, this is as high as it'll get, and then you'll be forced to try and squeeze and clench and do everything. In which case, this is where you stay. For the rest of us who can get beyond it, keep levitating. Don't be tempted to squeeze your glutes, not yet. Your glutes will really start contracting when you get to almost a level position, and now we've got the glutes really squeezed on. But I've contracted them as in through movement. They've just shortened. I haven't manually clenched them on. That's not good. If they don't fire at all at the top position, it probably means you haven't kept enough integrity at the pelvis. So what's happened is this has happened, which is where this coaching of the glutes comes from. Is that a bad coach? No, I wouldn't say so. Not once you got to that top position, just to make you more aware of how to align your pelvis. But it should be a pelvic cue necessarily rather than squeeze your glutes all the time cue. So be very careful with this exercise in the sense of initially you're training the deep longitudinal system, hamstrings and erectors, okay? So this bit is really just feeling base level contraction, low level stuff. So I should be able to stay here for minutes on end. If you're finding this super hard right now, like if you're copying me, like just hovering, you've got a big hole there and you want to fill it, okay? And that's what's really going to help you out with your strength. So anyway, top position, okay? You can then start thinking about just holding position or starting to take a leg off. Notice how I set up with two and then I challenge by taking one off. I'll hold it and then I'll place the other one back down. I'll wait until I feel I've regained my stability through my whole chain, and then I'll challenge the other side. A bit like doing the donkey kick, right? We're starting to build up our strength. If you get more advanced, then that's when we can start to take the feet wider and start to play around with more glute focused exercises. But initially, this is the one I want you to do.